Hello, everyone, and welcome to this mini lecture on critical thinking, as well as the Nursing Clinical Judgement Model. So, what is critical thinking? Critical thinking is the way that we use assessments and analysis to better understand, evaluate, and respond to an issue or a concept. This is a necessary tool for being a nurse and for nursing practice because it helps us to better prioritize, practice with patient centered care, help our patients to have positive health outcomes as well as patient safety. It helps us not only to formulate evidence based practice, but also to use it. And it's the foundation for utilizing our nursing knowledge to the best of our abilities. A lot of healthcare systems have identified that critical thinking is a skill that many new nurses are struggling with and have offered the challenge for nursing schools to find ways to better assist nursing students in formulating their critical thinking skills so that that knowledge gap can be shortened. Also, to address this knowledge gap that's been identified by the healthcare systems, the NCLEX has taken on the challenge of recreating to the next NCLEX next generation, which aims to better assess critical thinking and help nursing students as they sit for their accreditation testing to better prove their ability and their critical thinking skills. So prior to 2021, we used what is called the nursing process. And the nursing process is the guide on how to structure our care as nurses. And it started off with assessment, then using the assessment went to diagnosis, then based on the diagnosis, creating a plan for the patient, then intervening, and then evaluating. Because we are trying to facilitate better critical thinking skills, the Nursing Clinical Judgement Model was created. And this took the nursing process and modified it so that we can better utilize our critical thinking skills. So the new Nursing Clinical Judgement Model is to recognize cues and analyze those cues. So the recognition of cues can be done through assessment. So we are assessing the patient's subjective and objective data, their health history, their head to toe physical assessment, their psychosocial assessment, whatever we need to. And we're taking that assessment and recognizing different cues that are maybe leading to something that may require care. Then we're going to analyze those cues and see what's really going on. How do those cues drive what's going on with the patient? How does it drive our care? Then we're going to prioritize our hypotheses. There's a lot of different ways to prioritize. And that will be talked about in another mini lecture. But ultimately, the things we want to prioritize most are going to be things that may be life threatening. So, airway, breathing, circulation, safety, and depending on the type of cues that you're analyzing and the patient needs are going to determine how we prioritize. Then, after we have our priority, we're going to generate solutions. How can we address those cues? Once we've generated those solutions, we can take action. And then the last step is also going to be to evaluate outcomes. So it's very similar to the nursing process, but it adds in a few extra steps to help really hone in on how to use those critical thinking skills. So, how do we facilitate critical thinking? There's a lot of different skills and tools that can be used to better our critical thinking abilities. One example is the scientific method or using research inquiry. Another would be the decision tree. Then we have our 5 whys: who, what, where, when, and why, sometimes how. Flipping the classroom is another big tool to facilitate critical thinking. So, for those of you in nursing school, you may see a lot that you may be asked to prepare for class or lecture by doing the reading, watching different videos. Then, when you get to class, instead of having a traditional lecture where the professor is feeding you the information, you may have to do different activities to apply the knowledge that you've already prepared. And the reason that we are flipping the classroom is because it has been shown to facilitate that critical thinking, even though it may be uncomfortable at first. The simulation is a very, very important tool to facilitate critical thinking. Also, case studies and mind maps. There's a lot more other tools that can be used, but these are some common ones that may be used in nursing school and may also be used as nurses when they are working in the healthcare system. So I do want to talk a little bit about mind maps specifically because I think it's a really useful tool in helping to understand the full picture of what's going on with your patient. So this is a critical thinking tool that aims to help one make connections and understand the whole picture when considering patient care. This helps to visualize the patient's history as well as to understand the different symptoms they're having, what their possible diagnoses are, and how to provide that care. It also guides understanding of patient priorities. So I am just going to kind of walk through an example of that and show how to utilize a mind map. All right, so here we have the start of a mind map on a made up patient. So our patient AA is a 36-year-old that came in with abdominal pain. So just kind of getting the health history, this patient has no known medical history, no known medication allergies, no known allergies, and they don't take any home medications. So based on that, we really don't know what could be causing this abdominal pain. So we're going to go and assess their lifestyle. So this patient frequently exercises, they travel often, they drink limited alcohol, but they do have a stressful job. Um, Upon their assessment, you find that they have a distended abdomen, they have intermittent cramping, and their last bowel movement was 2 days ago. So this mind map aims to help us make connections between what little we know about the patient to get a better understanding of how to treat them and how to prioritize their care. So, kind of knowing what little we know so far, we can do further assessment. So, we can look and see that really their health history and not being on any medications or anything, it does not really drive any of the assessment findings that we have. So we can use different symbols, different colors to kind of indicate different things in these mind maps. So you can see I have basic categories kind of squared off, and I have different arrows going from the patient outward. So this is showing that this is the patient and this is some of their health history. This is their lifestyle history. This is their assessment data. But we just identified that their health history really doesn't give us any information about their assessment. So we can go ahead and create a specific symbol, however you want that symbol to be, to show these are not connected. So here I have an arrow with a line across saying, we really can't get any information on why their health history is driving this assessment finding. So then we can look at the lifestyle. Is anything with their lifestyle indicating any potential development of these symptoms? So frequent exercise usually doesn't cause too much abdominal pain unless it's maybe a strained muscle. But with that strained muscle, I don't know how often we'd get the intermittent cramping. So we can move on to frequent travel. So frequent travel may cause maybe some differences in diet or some differences in food. So um, we can go ahead and add in an arrow there because that may be a contributing factor, but we don't quite know if it's a factor yet. So I'm just going to put a little question mark above it, and that will let us know, hey, this is something that we might want to look into. You also find out that they have a stressful job. Sometimes having a stressful job can lead to different things like stomach ulcers, things like that. So, is the stressful job contributing to these assessment findings? Again, we don't know, so I can put a question mark here. So, upon further investigation, we actually find out that because the patient has a stressful job and frequent travel, they don't have as much opportunity to drink fluids. On top of that, they're exercising frequent, and so their amount of fluid intake is not quite what we need it to be for them to maintain healthy bowel movements, which may be contributing to why they haven't had a bowel movement in 2 days. So now we can take another symbol to identify this and type in that potential cause may be fluid deficit. Another approach that we can take is, hey, we have all this assessment data. We need to understand what's going on a little bit more. So this assessment data is going to go ahead and drive our diagnostic testing. So we're only doing things like an abdominal x-ray or an abdominal CT or an abdominal ultrasound or a stool sample because we have these symptoms going on and we need to understand why. After we do the diagnostic testing, after we determine some factors of their assessment, we can drive treatment. So, based on our diagnostic testing, we found out that the patient has a lot of backup of stool and that they're quite constipated. We can also determine this by the fact that they have not had a bowel movement in 2 days. We have also determined that they have fluid deficit. So, all these factors are going to drive why we treat the patient with the treatment that we do. So, because we've identified that it's constipation, we can provide them with stool softeners, fluids, and mobility. So, every mind map, and this is just a very, very, very basic one, but every mind map is going to look totally different based on the situation, based on the person creating the mind map. But ultimately, you want to have something in the center, whether that be a diagnosis, a patient, a concept, and then you have key concepts surrounding it. After you have those key concepts identified, then you have different symbols in areas where you try and make connections between those different things. So, as I mentioned, this is a really effective tool in helping people to apply critical thinking and look at the whole picture to get a better understanding of what's going on with their patient. And that wraps up my lecture on critical thinking.